My name is Alicia Mandel. I'm originally from Minnesota, but I've lived in Hawthorne Woods, Illinois for 24 years. Met my husband 30 years ago in Minnesota. He was a resident and I was a nurse, and it's that story. We fell in love, had a few kids, moved here. Life's been great. A year ago I was diagnosed with cancer. Basically I had stage 4 colon cancer. Over Labor Day of 2020, I had 3 rounds of chemotherapy. And then after that, I think it was October, November, Dr. Kircher, she gave me a call and said, hey, guess what? Great news. And I'm like, what's the great news? My cancer's gone? Haha. And she's like, no, but we did that biomarker testing. And I'm like, yep, I remember that. And she goes, you qualified to get immunotherapy. And then she called me last Friday and gave me the amazing news, actually, that I'm sharing now publicly for the first time because only my children know, and my husband, that everything in my colon is gone and that I had 49, and yes, 49 positive lymph nodes in my body, and I have 0. So right now I'm not calling it cancer-free. I'm just saying they have no signs of cancer in my body. I would not be sitting here if it weren't for God and if it weren't for immunotherapy and biomarker testing.
Biomarker.
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 Biomarker testing. So think of it, biology and marker. Your body is a biological entity, and there are markers of normalcy, of normal aspects of your body, and abnormal. So biomarker testing is looking for those abnormal aspects of your body that would indicate cancer or guide a process for treatment of cancer.
I am a 2-time thyroid cancer survivor, and that's how they detected the cancer came back the second time in my lymph nodes, was after having that test.
I think the real big impact is personal knowledge about what you're facing, and in many cases that knowledge is going to overcome the fear and lead to success.
Which in my case, they did the test. They found that it was in a couple of the lymph nodes. We went back in, we removed the lymph nodes, and now it's gone, and the markers are not there anymore.
Biomarker testing is routine for certain populations and game-changing for the course of their cancer, whereas other populations, for a variety of reasons, are not able to equally access this.
So many people, because they didn't have the right type of income, didn't live in the right zip code, didn't know the right person, unfortunately they didn't get the same type of care that other people may have gotten that had means.
And I don't think that's right. It can't be right. That can't be the world we live in. Why should I get something that somebody else doesn't? I don't deserve it any more than anyone else does.
So this bill is really designed to prevent that new technology from widening the disparities.
When the American Cancer Society brought this to my attention, I realized that this can help people throughout the state of Illinois.
This is everybody in and no one is left out. That's what I love most about this legislation.
I am very proud to say that I was part of this, and I think it is a very proud moment for the state of Illinois.
Illinois is serving as a leader, and I imagine that many other states will follow that lead soon to onboard biomarker testing.
Why wouldn't everybody want this? Why wouldn't every state in the United States say, let's do it? Look at what it's done for people. We could actually get a handle on cancer treatment. I mean, come on, this is what people have been waiting for years.
Less treatment, less pain, less sickness. I feel this eventually will end, the suffering and the death caused from cancer.
I want to thank the American Cancer Society for helping to put forth this legislation and for their tenacity and their hard work and never giving up.
ACS CAN is the real deal. I have not met a harder working, more dedicated group of people that are fighting on behalf of cancer patients. They fight and they fight hard, so I'm very impressed and really pleased to partner with them.
So many people's lives will be made better as a result of this legislation. Not that we found a cure, but it's about the closest thing that we can get, and we'll take that for now.